learned a lot about Texas. But I think it was fairly informative, so I think both of them. Yeah. So, and I want to thank staff, all three of them. They're all here. Stacy, you're back. Thank you for coordinating these. Thank you, Alexis. Thank you, Stacy, for today's. And April for last week. So I think we accomplished some stuff, and now we'll get to doing bills and et cetera. Okay. My goal in terms of voting and putting these bills on is, once again, we will absolutely have the largest number of bills in the Senate and probably the whole legislature. And we get criticized, I get criticized for, why didn't you move my bill? And I hear that a lot from the House when there are 30 or 50 or 70 in that last week of session. So as much as possible, I want to clear our plates for the more complicated bills. It doesn't mean if you're not ready and you need more information, you can put a hold on, okay? But I want to move fairly rapidly in the early stages on the non-controversial stuff. So that's the mentality and MO I'm sort of following at the moment. As I said before, and I asked you whether you prefer Thursday afternoon or Friday, I'm hoping the first couple of weeks it'll be Thursdays, but there are a lot of bills they got to schedule. And if we end up with 10 bills on a Thursday and some are controversial, we're going to have to vote on Fridays, whether it's a pro forma session on Friday or not. And I think my guess is before too long, the Senate President will have sessions on Friday because we'll be here anyway. I think budget and taxes, or somebody's voting at 8:30 tomorrow morning. And I want to let you go, particularly the ones who have a longer drive, Senator Carrozza, Senator Gallion, I think mostly it. So I want to free you folks up to leave today, but it's going to turn into Fridays, just so you know, at some point. Yes, Senator Patterson.
I'll see you personally. I got a procedure question, but I'll get with you.
We're going to go into a voting session, so we are streaming it. I want to start with Council Morton, because a number of the bills have to do with sunset review. So I just wanted to give some context from DLS.
So the Department of Legislative Services changed the way sunsets kind of happen, or it was changed in statute, I think in 2019. Even earlier. Was it even earlier than that? Stacy might have to jump in and remind me of some of the details here. Basically, the way that sunset evaluations currently used to happen, so there's about 70 different boards that are subject to sunset on these 10-year cycles. And what used to happen was that a couple of years before the board was about to sunset, the Department of Legislative Services would do this sort of pro forma, we'd call it preliminary evaluation. And then on the basis of that, there'd be a decision, I think, by the Legislative Policy Committee about whether or not the board should be referred to a full evaluation. It was a lot of work for what seemed to be kind of very little benefit for the department and for the legislature. And so what they ended up doing was passing a law that sort of said, we're not going to do these evaluations unless the legislature, the policy committees request that we do so. And that request, it's a judgment call, but the idea was that, when these sunsets come up, you might get some testimony or something that might flag whether a board is struggling and might require further evaluation. So that's kind of how the process is laid out now. just to be clear, these evaluation, or the whole idea of board sunsetting and the whole idea of the evaluation process, it's not the same as an audit process. It's to look more holistically at how a board is functioning, and whether it's continuing to sort of serve the purpose that it was established for, and whether it's worth keeping that going. There's nothing, extending the termination date on a board does not mean that you can't come back in a year or 2 years or any time really and make changes to that board. It's really just an up or down vote kind of on whether to keep the board going. Have anything to add, Stacy or Alexis?
I want to underline the last point. So in other words, we're saying you can continue operating for 10 years. If 2 years later, your office gets 15 complaints about the licensing board for engineers, we can bring up that issue and either call for a report or come back and sunset it earlier. The law can be changed every year. So by giving it an extension means you're allowing them to run. It doesn't mean they can't be held accountable or action can be taken more frequently. And you need to understand, and I'll call on you in a second, and I mentioned this to Senator Frey Hester today, there are some boards that have been under heavy controversy. Board of Physicians was that, I don't know who handled that, but for years there was a back and forth and complaints. It didn't run well. They didn't like the investigations. There were some with the nurses. There were some with the dentists. So some have, over the last number of years I've been here, been in front of this committee or similar committees frequently. Others you never hear of. And they're very pro forma. They function. They're not acquiring a lot of money in a fund. There are very few complaints. You can get complaints to the board, and as legislators, you'll hear about them if someone is being wronged or doesn't feel they're being treated right. And barring that, we assume they're running okay. But again, at any point, people can bring up the issue. Senator Carrozza.
Thank you, Mr. Chair, and thank you for the explanation and April's explanation. I think for us on the committee, and maybe this already exists, but there are so many boards and commissions, some that, you see it's an automatic sunset, so why would you do a review if they have routine work? And then others, like for instance, I'll bring up an example that prompts me to ask some questions. And maybe this exists within DLS, but is there actually, I'm a visual type person, is there something that shows all these boards and commissions that, you can say, we get them as they come up on a piecemeal basis, but I didn't know if there was something like that existed. I certainly think that approach, like, why do these reviews if there's automatic work and, we just, are going to automatically extend them. But for instance, on SB 182, the State Board of Electricians sunset extension, that kind of prompted me. We had an electrician's bill last session that went back and forth, and during the interim, there were some issues raised, and there's some discussion about a technical corrections bill for that I've been in touch with Senator McCray and Delegate Hornberger. But I was using that when you see these come up, then it kind of triggers, well, what do these boards do when certain issues do come up? So, that explanation is helpful, but I'm just, I guess, Mr. Chair, trying to, understand our role as oversight of these boards and commissions, that, yes, we allow them to continue, but how do you see our oversight role with them?
We needed to distinguish policy from operations. I mean, Senator McCray's bill last year was a change in policy. And there's some question whether we set the policy right. It really didn't deal with the operations of them dispensing license, of investigations if someone abused something, or any kind of discipline. So I think changing policies of what they should do or shouldn't do, or expanding their authority, I think is one question. The other is its ongoing operations as a board overseeing it. And, I don't have a great answer for that. I just think the ones where there's a problem, they surface one way, shape, or another. And I think there are lots of boards, and hopefully we can get a visual of that, and maybe with, when they come up. I mean, we can try to oblige your overall visual concern. I don't have a better answer for how we should deal with all the, I mean, even under the Department of Health, I mean, there are so many, there must be 10 or 20 under that alone. 27 under,
I'm pretty sure that's
yeah.
the number.
This, one of the extension bills, or one of the new bills where they're setting up a new board, it's in the state government article. There's a list of every single board that is subject to the sunset law. And it's quite extensive. I don't know what you mean by a visual, I mean, other than a huge list of 80-some
Well,
board
I'm not trying to
names.
do make works, you know, so please be clear on that. But when we come in as members of this committee, and especially being new members, all of a sudden, we are, you know, looking at, you know, all these sunsets of all these boards and commissions. You know, maybe it's just helpful that kind of boards and commissions 101, there's, you know, X number of boards and, you know, here they are, here's our responsibility.
think
It was
the-
more or less, you know, this, I think April's explanation prompted me as a member to try to basically have a little bit more knowledge of the breadth that we're talking about with the boards and commissions.
So the overarching purpose is, do you believe that individuals should still be licensed or regulated by a board to continue that board? If you believe that, then you should extend it, and if you have an issue, then you report it, and then a full sunset evaluation can take place. And a full sunset evaluation means looking at their financing, looking at their complaint process, looking at their investigative process, looking at the licensing process. Do they do it efficiently? Do people have to keep coming back? Are the qualifications of members set? Do the board meet every single month? Do they meet sufficiently
Well,
enough?
that's part of the
Right.
review, I get
That's
that.
exactly
Maybe
right,
you could
so-
just provide the list, or, you know,
Sure.
I was, again, it was more the context, because we tend to deal with, we basically nickel and dime them as they come up.
Right, but it's also, most boards are not as big as the physicians and the nurses and the dentists. The physicians are 5 subcommittees of multi-professions, plus this massive, like, 21-member board or something, and nurses, and they have tens of thousands of licensees versus an electrolysis board that's not existent anymore, but they were, you know, a few hundred people. So, I mean, you're looking at degrees of magnitude. It can be a very difficult thing, but it's also, I mean, you look at the state electricians, do you want to just throw that out there where all of those licenses would be repealed and anybody could?
No, I'm sorry, you
Yeah.
misunderstand me. I was trying to understand the boards and commissions in full context, that's all I was trying to, you know.
But I think Ms. Goodman's point is an important one. We have the right to review or these at any point or any time if we don't think they're operating correctly or abusing the public, or they're not protecting the public, or they're trying to hoard money. We can take that up any time. This extension essentially says they can exist if we don't do the extension, and sometimes the review and the extension have come together, right? So I think what's been raised is that allowing them to continue operating as an oversight board is what the sunset extension is, but it doesn't preclude us from taking up any of these boards at any time if we are suspect of either how they're running or if they're protecting or not protecting the public. So I think they're trying to disaggregate those two responsibilities. I think I had Senator Hester, then Senator Washington.
I have one question, and I also have some information to share. So the information is that I did follow up with our auditors, and I asked them if any of the 8 boards in question had been the subject of any audit findings, which is a different set of questions than the sunset review. Nonetheless, I think it's important. The gist of the email that I got back from Mr. Hook, I thought it was a very good email, and I'm happy to share it with anybody, but he said that the ones that are under the Department of Labor, so the architects, the electricians, HVAC, plumbing, and professional engineers, he doesn't have concerns about. He then said that for the ones that are under the Department of Health, the psychiatrists, the optometrists, and the physical therapy, he sent me a report from January 2021 with 3 findings that he said applied to these boards. the first one being around cash receipts. Controls over the collections and deposits received at the health professional boards and commissions were not adequate, and duties related to cash receipts and licensing were not properly segregated. And so, and he said this applied to all three of these boards, and there were two other findings. It was findings 3, 4, and 7. So I guess, I mean, we're having this conversation about what it means to review a sunset, but, I mean, it could be an entirely different committee here next year. So, I mean, I was thinking that we want them to keep going, right? But we do want there to be some looking into whether they've corrected the findings in this report. So I would suggest that for the 3 health boards, we extend it for a year and do some digging, or whoever's, and if nobody cares that these findings are here, then that's fine too.
10 motions when they're in front of us. Senator Washington, followed by Senator Patterson.
Yeah, thank you. And so this is a continuing of the good senator from the Eastern Shore, sorry, Lower Shore, and a combination, I think, also of Senator Hester's. I guess we're trying to prepare, right? And so we want to be responsible and try to prepare. And so some of preparing is knowing, okay, this is going to come up, right? So it's very difficult because I've tried to find a place where all the boards are and their expiration dates, for example. And because I also see a bunch of advisory committee, they're all sort of mixed together. So when we get testimony, we don't hear, I don't remember hearing the findings of the audits. So it would seem that, you know, for this year at least, that we should, as a matter of practice, if there are any audit findings associated with any of these boards and commissions, that should be a part of the testimony, right, or a part of our packet. So that's one thing we could do. The other I do support, because I do think that we should take these, I do take this responsibility seriously, and if we don't have enough information to say go on for 10 years, that I would second, if that's a motion, I would second, you know, renewing everybody for a year and then coming back and looking at it. But I do think the website and the way that the boards are organized, we really have to have a better way, because I absolutely get Ms. Goodman's and Morton's, you know, position, but it's just not really easy for us to find out what we need to know about these boards.
Patterson. Oh, she's not there. If there was an audit in the last 12 or 15 or 24 months, is there a way we can integrate that into a hearing? Or do you just ask that as a standing question? Or I don't know how frequently the audits happen. Do you know, Senator Hester?
I don't.
Okay.
No,
Okay, let's check on that, and we'll take that.
Yeah.
And maybe as they come up in advance, we'll ask if there's been an audit in the last 12 or 24 months, an audit rather than a review.
Yeah.
Okay, Senator Patterson.
Thank you, Mr. Chair. I don't have a solution for the problem at hand, but I share the need for some type of coordinated effort in terms of how we're looking at this total project. I just experienced some situation. I talked with Senator Lamb about it. The review was done 18 months or 2 years ago. Heavy recommendations were made. Nobody has gotten back with the respected agency in the community to let them know whether or not all the piles and days and nights of information they put together in preparation for the audit, and then it just left hanging out there. So I just think we need a little better system, and I don't coordinating this I'll be, I like to look at inclusion too sometime. I want to make sure these boards and things reflect the makeup of the state. And I don't know how you get that information if you're not somewhat connected with the review of the audit and that kind of stuff. So I don't know, but I think it's something we need to stay on top of, because I think the way it's operating right now, I think it's just haphazardless, and it's just not worth the time, I think, if you're going to continue doing it the way it is. Thank you.
And we'll take each one as they lie, and if there are problems, we'll host amendments. Okay, first bill, Senate Bill 50. Okay, and then let's go to Senate Bill 168. Okay, we'll go to 171.
171, we're holding for an amendment.
Do you want an additional?
See what I mean?
I didn't have that hands up.
Senate Bill 171 is a departmental bill from the Department of the Environment that modifies public participation and notice requirements for several licensing, permitting, and regulatory promulgation sections of the Environment article. Generally, the bill authorizes public hearings and meetings to be held using teleconference or internet-based conferencing technology unless an in-person meeting is specifically required by federal law or is requested by any person. The bill applies to authorizations issued for controlling air emissions and water pollution discharges, drilling of oil and gas wells, non-coal surface mining, constructing and operating solid waste facilities, sewage sludge utilization, and activities that would disturb Maryland wetlands and waterways. There is an amendment in your voting packet on page 5, being offered by Senator Pinsky. This amendment strikes language that would require permit and license applicants to bear the cost of public meetings or hearings held using teleconference technology. So this is the one that was emailed out. That I don't know if they made more copies. Okay.
No, it's in the packet. These were emailed to us.
Mary Beth, do you have this?
Thank you, my friend. Yep.
Yeah, it's coming.
Good.
Good job, Ed. Oh, nothing but the best.
Good man, good man.
Those things on.
Oh.
So is this with my amendment?
Yes.
So it's just by taking this out?
Yeah, I mean, it's in other places too, but yes.
Hold 1 second.
So just every time it appears.
So, what does it say explicitly? Where's,
So it just doesn't say, if you don't say that the applicant has to bear the cost, then they don't.
administration bill to streamline a few things, and the amendment that Ms. Morton talked about removes the language where the cost must be borne for a virtual meeting. So first, let's get a motion to put this MDE bill before us. Is there a motion?
Favorable.
Okay, it's moved and favorable. Would anybody like to move the amendment?
I'd like to move the amendment.
Okay, is there a second? Okay, on the amendment,
Mr. Chairman,
yes.
just curious, what expenses are in a tele
Just I don't need a long answer, just,
Like a Zoom membership.
is that what?
I think that was the question. So they reproduce that language because that's the way it works for in-person hearings. And in-person hearings, you have cost associated with renting a room and things like that. And the question was, how does that translate to teleconference stuff? And even the department was sort of like, we don't really know,
So if
so.
it's borne by the department will pick it up. They're not gonna pay for the people for any expense they have, correct?
Right, so it just
Okay.
means that
Whatever the department, they'll just cover the cost to do it.
of holding the Zoom
that's
briefing or whatever they're doing.
Okay. On the amendment, any objection to the amendment? Seeing no objection, the amendment is adopted. So we have the bill as amended in front of us.
Any additional questions or?
Yeah, that's what I'm
Okay.
doing now.
Okay.
So the bill's amended is in front of us. Questions or debate?
Yes.
Okay?
Thank you, Mr. Chair. When I had asked about the cost of teleconferencing and that I didn't think it should be borne by the petitioner, I also had asked about transparency and how the average public would find out about. And they kind of shrugged their shoulder and said, yeah, I guess we'll put it on our website or something. And I'd asked whether we could have better clarity on that. And the drafted amendment doesn't cover that. And I just wondered whether that's something that we could discuss, because it's in here, there's an amendment that just is a spelling thing on the word website. Page 5, lines 3 and 4, the type of public notice required under this title that are available on the department's website. But it doesn't really require, it just seems to me that interested parties should be able to find and participate in a public online meeting in the same way they would if the meetings were held in a community center or some other location.
So and they emailed you this. So they did send you an email, Senator Kagan, as a follow-up. So it's the issue is that the notice provisions are not in the sections that they were amending. They're in section 1-602 of the environment article. And so already, wherever the subtitle requires the department to publish notice, it has to be published at least once a week for 2 consecutive weeks in a daily or weekly newspaper. And in addition, the department must post it electronically on their website. So that's that's section 1-602 of the environment article that already has all the public notice provisions that apply to everything.
Thank you. I'm looking for that email and asking my staff. I did not see that. Thank you, April.
Okay. Discussion on the bills amended. Seeing none, Senator Carozza.
I just want to clarify, so basically the amendment is saying, when there's a virtual hearing, that the person who's requesting the hearing, it's not at their expense?
Right.
Correct. Right.
If it's
Right
virtual.
now, the applicant has to pay for any cost associated with the hearing. Right?
With an
And
in-person hearing.
so in other words, if a room has to be rented for $50 or $200 or whatever it is, it's my understanding the applicant picks up the cost. If they're requesting a permit and a public hearing has been called, they pick up the cost. We wanted to make sure if it's virtual, any cost is marginal and there shouldn't be a cost, they shouldn't be billed. Is that correct?
So if at virtual, there's no cost. In person, what happens?
Ms. Morton?
So the current law is that the permit applicant or the license applicant the law just says bears the cost of holding the hearing.
Okay.
So is not changed in the bill as introduced, it's not changed by the amendments. All the amendments say is they took out the bill as it came in would have said that, okay, so if we decide to hold it by teleconference instead of in person, we're going to apply that same rule that the applicant bears the cost. The discussion was that cost should be so minimal, how would you reasonably apply that to the applicant? Let's just say we're taking that out. They
Understood.
wouldn't have to take
Thank you.
bear the cost.
Okay, will anybody be voting in opposition to SB 171. Seeing no hands, that passes and goes to the floor. Yeah. Whew, painful.
May they all be like that.
Yeah. Well, Ms. Goodman's confusing me here. Okay, let's go to 168.
Do you want to go back to the start, or do you want to?
Well, this first one is Stacy's.
The Department of Health, Immunet, Statewide Advisory Commission on Immunizations. So the bill removes a particular exemption that excluded certain healthcare providers who vaccinated in certain facilities, nursing homes, assisted living facilities, retirement communities, and medical daycares. And they removed this exemption from the requirement to do several things: report vaccinations in Immunet, inform patients of the right to refuse, to provide refusal to permit forms, and to provide forms which documents information on Immunet. Then it removes term limits on several members of the Statewide Advisory Commission on Immunizations and alters the composition of the board. And for those term-limited members, it increases the length of their terms from 3 years to 4 years. There are 3 amendments accompanying this, 2 of which are in your amendment packet, one which was on the supplemental side. The first amendment is sponsored by Senator Lamb. If I'm not mistaken, that's the order in the packet. The amendment adds 2 positions to the commission. One is a school health nurse, and the other is a school-based health care provider from a particular organization. Okay, so that's number 1. The second amendment is sponsored by Senator Pinsky, and it permits the state epidemiologist to serve without first being appointed to the board. And this posture is similar to 2 positions that are already there that do not require prior approval by the secretary. They can serve without prior appointment. So it will give the state epidemiologist that status. And then the third amendment is also sponsored by Senator Pinsky, and it removes the chair of the Maryland Childhood Immunization Partnership from the commission. And that's the one that is not in the packet, but is beside it.
Bill before us, and again, these were requested by the agencies. Is there a motion, a favorable motion? Is a motion favorable? Lamb, second Riley. Let's try to take each of these amendments one by one. Senator Lamb's amendment adds 2 people to the advisory board, I think.
Favorable.
Second. Any objection to adopting this? The Lamb amendment's adopted. The next one is on page 4, the Pinsky Amendment, which it's got a designated position, so they really don't have to be recommended. That's what this does. It says if the immunology, they're on this and they don't have to be proposed and adopted. They're just designated. Second, any objection? Yeah.
I'm not sure the amendment you were talking about. It's on page 4
Yeah.
of the package.
Yes.
It's just, I just see, is that amendment number 1? I just see like
Page,
line numbers and that's it, not what you're saying.
You can take that separately, Mr. Chairman.
no, that's a different one.
And that's the Senator Lamb amendment that we just adopted.
Right, I see that
And then
one.
there's one on page 4, which is a Senator Pinsky amendment that we're talking about now. On the back side of that one, we kind of,
Yes, I'm looking at page 4.
so yeah, that's the one. It wasn't a lot of substantive language because we just striked
Yeah.
some things.
So it seems like you're saying more than I'm reading. So on page 4 it says, amendment number 1, on page 3 in line 22, insert a comma after C1.
Right, so basically, looking at the bill, the state epidemiologist was like subsection 5. And so where we put insert 5, that is the language preceding it says that these particular members don't have to be appointed. So that was kind of a faster
Okay,
way
so
of doing
that
it.
language is already in there.
Yep,
Just-
that
okay.
language is in
Oh,
there,
thank
yep.
you, I appreciate that.
Okay. Any objection to adopting the Pinsky Amendment on page 4 regarding the state epidemiologist? Seeing no objection, that's adopted. And then there's a third one that was handed out. And again, this was requested by them, by the agency, I believe. Is that correct? And just repeat what it does.
So it removes the chair of the Maryland Childhood Immunization Partnership from the commission.
And because I have so much trust in the administration, I just accepted it. This is what they wanted, so I put it in for them. Second? Or frown. Any objection to adopting the single piece of paper? No objection, that's adopted. That's it, Alexis, is that right?
This one, yep.
Okay, the
That's
bill
it.
as amended. Anybody voting in opposition? Seeing none, that passes to the floor unanimously on 168. To 178.
Okay. Senate Bill 178 is a departmental bill from the Department of Natural Resources that repeals the requirement that an applicant for local program open space funding must certify on each application that the applicant has, 1, applied for federal funds and received notification of federal approval or disapproval, 2, applied for federal funds and has not received notification of grant approval or disapproval, or 3, has verified that the project is not eligible for federal funds. Instead, the bill requires that the applicant must certify that the applicant has or has not received federal funds for the project.
Put it on, is there a motion to put it on the floor? We move by. Discussion? Senator?
I'm wondering if this requirement to bring the federal programs into the program open space will create additional delays and complications and make it so much less efficient than it is now. Because in a bill I put in, and we had hearings on this week, they talked about how efficient things are, folks who oppose the bill, and things work smoothly now. So why would they impose other conditions to get these funds out to the counties? Little contradiction there. And when I look for equity in the application of the program, oh, it's very efficient, but now they want to put this in to create additional layers of applications and complexities. I have a little problem with this. So if you could we kind of put this off until another day so I can get some of the answers to this, or I'll take your...
A chance to...
Yeah, just to clarify that this is actually cutting a requirement. So right now, the local jurisdictions have to certify that they have applied for funds or they haven't applied for funds. This actually cuts that and just has them say whether or not they have received federal funds. They don't have to, right now, they essentially have to apply for those funds before they can even apply for the program open space funds.
I'll come back to you.
Mr. Chair, I just wanted to say, in the testimony, the Maryland Association of County Park and Recreation Administrators, the head of that is from my district, Steve Miller from Wycomico County, and they've talked about trying to just make this process simpler for the counties. You know, I understand the Senator Ellis's points on some other bills, but on this one, this is, you know, really a matter of simplifying it for the locals.
Back to you, Senator.
Thanks, Mr. Mr. Chairman. So, I mean, I just see hypocrisy everywhere, you know, and trying to get equity in the spend of these funds. They're saying how everything is smooth and great, and now they're saying it's not smooth and great. And so I didn't have a chance to take a deep dive into this, but, you know, I'd love to kind of do that over the next few days. Thank you.
Okay, so 182 is a sunset. So this pertains to State Board of Electricians. It extends the board for 10 years.
Okay, it's before us, no amendments?
No amendments.
Okay.
Was.
182 electricians, which falls under labor, not health. It's moved and seconded. That was not one of the ones Mr. Hooks brought to the front. Any discussion? Will anybody be voting in opposition to this continuation of this board? Seeing none, 182 passes unanimously. Let's go to 184.
So the same thing, just applies to the Board of Heating, Ventilation, Air Conditioning, and Refrigeration Contractors for the sunset.
Okay, it's been moved by the vice chair, seconded by Senator Riley. Discussion. Seeing none, will anybody be voting in opposition? If not, this will be recorded as unanimous. 184 to go to the floor. Next.
So SB 193, sunset for the State Board of Plumbing. Oh, I'm sorry, I was running through the sunsets. Okay. So 186 is the Maryland AIDS Drug Assistance Program rebates. So the bill requires rebates from the Maryland AIDS Drug Assistance Program within the Department of Health to be held in an interest-bearing account. And it requires the interest from that account to go in a specific fund to be used for the specific purposes of that program. There is one amendment that was supplemental to the packet, and this is sponsored by Senator Pinsky, and essentially it codifies that fund within statute. It does not exist, it's not identified yet. So it establishes that and directs where the rebate should go within the particular fund.
Right, but to be clear, the money in the fund and the interest goes to the MDAP program.
Right, it goes within the fund to be used for certain, MDAP is one of the programs, and there are two other AIDS, HIV-related prevention programs that it works with.
Okay. There's an amendment, again, this was requested, I think, by them.
By them, yep.
Yeah. Any objection to adopting the amendment? Seeing none, the bill as amended is before us. Debate? If not, will anybody like to be recorded in the negative? Seeing none, that 186 is passed unanimously to go to the floor. 190.
Senate Bill 190 is a departmental bill from the Department of Natural Resources. The bill increases the term of a member of the Tidal Fisheries Advisory Commission from 2 years to 4 years. That would make it on par with the Sports Fishery Advisory Commission. There is an amendment in your packet on page 19 being offered by Senator Pinsky. This would delay the bill's effective date to February 1st, 2023, so that it would apply only to members appointed on or after February 1st, 2023. And I think the concern there was just late-term appointments, essentially.
Okay, the bill has been moved and seconded. The amendment's been moved and seconded. Discussion on the amendment. Okay, look, you know, I just think fair is fair. I don't want things happening on the last night. I think the policy's fine, and whoever gets elected, and they can appoint whoever the hell they want to elect. So I just think, anyway, that's why I put in the amendment. On the amendment, all those in favor of the amendment signify by saying aye. Aye. Opposed, nay. Okay, the amendment passed. The bill as amended. Will anybody be voting in the negative? Seeing none, the bill passed to the floor in unanimous form. Ms. Foxworth.
So SB 193, State Board of Plumbing Sunset Extension, extends the Board of Plumbing for 10 years.
Discussion, seeing none. Will anybody like to be listed in the negative? Seeing none, the bill passed unanimously to the floor. That's 193. 195.
So it's a departmental from Department of Health, Sunset Extension for the State Board of Examiners of Psychologists.
So this is one of the ones that the auditors had concerned about, and if I'd had more time, I would have offered an amendment that would have just changed it to a one-year extension and asked them to report on the findings in the Health Regulatory Services Report related to findings 3, cash receipts, finding 4, licensing systems access, and finding 7, consolidation of operations.
That is a motion to amend it to 1 year with that request which people heard. Vice Chair.
Thank you, Mr. Chair. Senator Hester, I wonder, with a change of administration forthcoming, people coming and going and new stuff, I wonder what you think of 2 years or 3 years so that we clearly signal we want accountability. 1 year seems pretty fast with everything else, new legislators, new governor, new everything.
I think 2 years would be acceptable.
Okay. Any objection to that? 2 years with a response to the audit concerns as enumerated. Any objection to adopting that amendment? Seeing none, that's adopted. The bill as amended. Further discussion? Seeing none, will anybody be voting in the negative? Seeing none, Senate Bill 195 passes to the floor unanimously. Thank you. Great work. Okay, Ms. Foxworth.
State Board of Architects, Sunset Extension, request from the Department of Labor.
It's been moved, it's been seconded. Discussion?
Yeah. Sorry. This was the board that I had problems with, and I've been sorry. I just want to see if he responded yet. He did not. All right, let's move the bill.
Okay, the bill as amended is a sunset extension. It does not preclude this coming up if we're here next year. Okay? Would anybody be voting the negative? Seeing none, this will be reported to the floor unanimously on 199. Next, Ms. Foxworth.
Senate Bill 202, State Board of Examiners and Optometry, request from the Department of Health for the sunset extension.
Bill's been moved, it's been seconded. Do you want to replicate the last motion? Amend it to a 2-year sunset with a request that they respond to the audits that were cited in the last report or whatever. Okay, any objection to that amendment? Are we okay? You can work out the language. I think we're all on the same page here. No objection to the amendment. It's adopted. The bill as amended. Will anybody be voting in the negative? Saying none. 202 passed unanimously to the floor. Thank you. Next.
Senate Bill 209, State Board of Physical Therapy Examiners, request from the Department of Health for the sunset extension.
209, we skipped 204 because
We're on 204.
I'm sorry, I've talked out of turn. I'm sorry,
Stephen
Stacy.
was not here, that's why I assumed you went to 209.
Oh, I'm sorry.
But now she's back. But
Well,
she was describing
Yes,
209.
yes,
Let's do 209 and then go back.
yes.
Okay.
I apologize. 209. Just briefly, again, I was looking at 204 when you're talking 209.
So departmental request from the Department of Health to provide a sunset extension for the State Board of Physical Therapy Examiners.
Okay, so we'll put this in the same posture as the other two bills. The bill's been moved, it's been seconded, it's been amended by Senator Hester in the same posture as the other two, giving them 2 years and respond to the audit. Any objection to the amendment? It's adopted. The bill as amended, will anybody be voting in the negative? Seeing not, it's passed unanimously to the floor, 209. Let's do 211, then we'll do the final two for Ms. Goodman. 211.
So Senate Bill 211, State Board of Professional Engineers, is a departmental request for a sunset extension from the Department of Labor.
Okay, it's been moved, it's been seconded. Seeing no amendments, any discussion? Seeing none, does anybody wish to be recorded negative? Seeing none, it passed unanimously to the floor. That's 211. Okay, now we go back to 50, Senator Young's bill and Ms. Goodman.
Senate Bill 50, Higher Education, Returned Peace Corps Volunteers, In-State Tuition. This bill exempts a returned Peace Corps volunteer domiciled in the state from paying non-resident tuition at a public institution of higher education in the state. A community college student who pays in-state tuition under the bill must be included as an in-state resident for computation of state aid under the CAID funding formula for community colleges and the Baltimore County Community College funding formula. There's no amendments and no opposition.
Motion? Favorable, seconded, discussion? Seeing none, all those in favor signify by saying aye. Opposed, nay. The ayes have it unanimously. 50 is adopted and will be reported to the floor. Then we will go to 204. Ms. Goodman.
SB 204, State Libraries, Maryland State Library Board, Membership. This bill replaces the Secretary of Higher Education with the President of the Congress of Academic Library Directors as a member of the State Board.
It's been moved by Senator Riley. Is there a second? Second by Senator Simon Ayer. Discussion. Discussion, seeing none. All those in favor of a favorable report, signify by saying aye. Opposed, nay. The ayes have it unanimously. That'll be reported to the floor. Okay, we've moved all the bills. 78 is on 178 is on hold until the next voting session, which is likely to be next Thursday. Is that right, staff? It's likely to be Thursday. Let me make one comment, and then people should fly away to their respective homes, hopefully, or offices. When we have a hearing and you're skimming through the bill and you see there's a gap, or you like the bill but you don't like something, come up with an amendment. Okay, I mean, occasionally we can do it on the fly like we did today, and, you know, we're going to allow that. And I did a few amendments after I met with committee counsel in preparing a voting list, and I took the initiative to do it. But we all got to roll up our sleeves, and so if we want to make bills better, people should not hesitate. And in some cases, some people will offer you amendments. We know that from advocates and interested parties, but you can help shape it as well. So I'm encouraging you to not hesitate to draft one, call the amendment office and say, look, I want an amendment to do X to this bill. Look, it may pass, it may not pass, but, you know, discussion about improving a bill, ideological struggle is healthy. So I just want to encourage that. And with that, I won't keep you any longer. We got a lot of work done this week. Obviously, you can work from home tomorrow or do whatever you want to do. Well, yes, Mr. Pro Forma. So anyway, with that, thank you all. Be safe, be healthy. We're adjourned.